Siri, how do corneal melting ulcers form?
Here is what I found on corneal melting ulcers. It begins with a superficial ulcer, which is formed when there is trauma, conformational disorders, eyelid abnormalities like trichiasis, dystichiasis, ectopic cilia, infection, KSE, neurological defects and foreign bodies, just to name a few. Next, you need to perform a fluorescein stain to confirm the presence of an ulcer.
I guess that means lights out, Doc.
The fluorescein test appears positive. Superficial ulcers should heal within a week. In certain cases, superficial ulcers can begin to melt because of varying situations. Endogenous proteinases produced by leukocytes or secondary bacterial infections such as Pseudomonas and beta hemolytic strep produce collagenase, which the corneal stroma.
Siri, what are some clinical signs?
Some characteristics of melting corneal ulcers are as follows: severe corneal edema, variable depth of stromal loss, soft melting corneal stroma, yellow cream stromal infiltrate, corneal neovascularization. A dysmetazole is stromal loss down to Descemet's membrane. In this situation, fluorescein staining will not adhere to the membrane.
Siri, what are the medical treatments?
Treatments that can be used are as follows: proteinase inhibitors, which inhibit endogenous and bacterial collagenases. A few examples would be serum and EDTA. This prevents the continuation of stromal melting. When there is active melt, we want to apply these directly to the eye every 1-2 hours. Topical antibiotics may be given based on severity and cytology, or broad-spectrum oral antibiotics may be given. A systemic anti-inflammatory should also be given to help pain and anterior uveitis. Atropine can be given as well to reduce ciliary muscle spasm associated with reflex uveitis.
Siri, what about the surgical options?
One surgical option is a conjunctival graft. A flap of conjunctiva is sutured to the ulcerated surface, providing blood supply to the ulcer. Remains in place for 6-8 weeks, then trimmed at the limbus. A permanent corneal scar will form. This does not bother cats and dogs. After completion of therapy, your eyes can look this good. Thank you for your time. Video and editing by Jairus Schumann. Siri voiced by Brittany Lister and the star of the show, Rigby.